everybody, and welcome back. Thanks a lot, Jenny, for helping out. So I wanted to talk about re-exams today. So a re-examination is something that is done in our clinic specifically for several different reasons, and I understand many people have questions about those, and I wanted to get those questions answered. So I just wanted to refer to a document that you can find on our website. This document is called Buyer Beware. There's two sides to it. On the back side, it outlines, basically what makes a good acupuncturist versus one that might not be as effective at getting you results. And there's a couple of things here that are really important. Basically the most important thing that separates us from many acupuncture clinics, definitely here in southeastern Wisconsin, but without question separates us from many of the clinics around the country, which is why people actually have flown here for treatments, is one key thing that we do different, which is that we chart function. Now you have to understand that the human body is designed to heal itself. And when we are charting function, what we're looking for is basically the body's response to care. So a person comes in with, let's say, migraines, and what we do is we treat the body so that the body can get rid of the migraine. All right, now that in itself, you should have had a moment of mental collapse thinking about that. It's a huge statement. I want to make sure that you get that concept, because that is an entire world of difference from what you are used to with healthcare in Western medicine and with acupuncturists, unfortunately. And I'm going to go into the history of Chinese medicine at a later date, so look for that so you can understand why the medicine has changed, and we're changing it back to the most effective original form. But anyway, so a re-examination. Let's talk about a re-exam. The first step of a re-exam would be establishing what kind of changes have occurred with the function of the organs, and what kind of changes have occurred with the circulatory system. And ultimately that's what we're working on to start with. And so we check the pulses, we look at the tongue, and you can go to our website www.milwaukeeacu.com to learn more about the pulse and tongue diagnosis, or you can call us and ask us, or email me, or whatever. In any case, that's the first step in a re-exam typically. The next thing is we may do other tests, including things like range of motion or what have you. The purpose of that is to determine joint and muscle function and so on. And there's other tests that we may perform as well. We will also go through the patient's main concerns, every single aspect of those, and then we go through every single symptom that the person had when they first came in, because we take responsibility completely for your physical health. So a person comes in for migraines, we're treating the person for many other things than that, even though they may not even know it or understand it. So I just wanted to clarify that purpose of the re-exam, and then ultimately the end point of a re-exam. We have a charting system that we use in the office. It's called a patient progress graph. And the purpose of a patient progress graph is to observe the functional improvements that a person experiences and the various phenomena of the body that it will go through as you ascend in function. Okay? There's very specific things that occur, not that we planned it or want it to happen. There's just things that happen when we chart function, and the function inclines, goes upward, that are just natural in the human body. As your function goes up, the body self-heals. Function goes up, symptoms go down. So anyway, I just wanted to clarify that. Now, let's say a patient was in a re-exam, and let's say that for some reason they were having a little bit of a hard time. Let's say that their function, went a little flat, or it went down slightly. We then investigate thoroughly to figure out why. About 3% of the time, it's that the body changed at a very fast pace that we didn't anticipate, and we need to come up with new points or herbs or whatever on our side of the equation to make things better. 97% of the time, it's what the patient has been doing, and they did something different. Like in the beginning, they made all these changes that improved their condition, started feeling great, and said I should drink more beer or whatever, And then they go like this, or they run into a situation that's out of their control with a family member or a boss or losing a loved one or something like that. And then the function is inhibited or slowed down in its progression. So instead of going like that, suddenly they hit a stress and it starts to do that. So what we do is we meet with the person and we go over a checklist that is just what we found after over 50,000 patients will enhance the results of acupuncture, and we help them to solve the problems that they're running into in their lives. In the very beginning, when you start care, we not only recommend doing acupuncture or any other modalities in the office, but we want you to get better faster. So we give you lists of things to do specific to your condition, but also general that people's bodies seem to do well with, that will enhance your results by 30 to 40%, so you need less of us. So then in the re-exam, we establish what may be done or what may not be being done by you as a patient, and then we come up with a little strategy so that if there was a slight, it's going like this and then it goes like that, or it goes like that, or it goes like that, we can correct it and you go up. We take responsibility for people's health on a level that is extraordinary. Our purpose is to help people become as healthy as possible so they can live as long as possible, which is the original reason this medicine was developed in the first place. The emperors in China were trying to figure out how to live indefinitely. They found that the body will live to 120. If you take care of your body and you follow the recommendations of your acupuncturist, you got the best shot at going that distance. Obviously it helps if you start from birth on. So if you have kids, bring them to us and let us do an exam and see how they're doing so that we can prevent all the problems that you're dealing with. That's the ultimate solution, prevention on a whole nother level. Anyway, feel free to email me if you have any questions. I appreciate you taking the time. Email me at curry@milwaukeeacu.com. I'm definitely interested in hearing from you. I want to know how things are going. Feel free to contact us if you need anything at any time. Nothing that I've said here replaces your medical doctor's advice. Nothing here has been evaluated by the FDA. I'm going to give you a little asterisk. But after about 4,000 years of medical history, you can pretty much trust what I'm saying. Thank you very much. Over and out.